Have you ever held your lipid profile report in your hands, stared at the numbers ... and had no idea where to begin? Don't worry. Today, I'll help you uncover the real story behind each number. Is high cholesterol really as dangerous as people say? Or have we been misunderstanding these numbers all along? In this video, I'll break down each one in the simplest, clearest way possible. LDL, HDL, they might sound complicated, but once you understand just a few key ideas, you can completely change the way you take care of your heart every day. 1. What is a lipid profile? The map of fats in your blood. The lipid profile, also known as a cholesterol test, is one of the most essential tests for assessing your heart health. If you imagine your body as a bustling city, then the lipid profile is the map showing all the traffic, that is, fats, circulating through your bloodstream. When the roads are overcrowded, congestion and accidents happen in the body. This means a higher risk of heart attacks, strokes, and high blood pressure. The lipid profile measures several types of fats, each with its own role. Understanding what each number means helps you and your doctor create the right plan for staying healthy. Total cholesterol, the overall amount of cholesterol in your blood. While cholesterol is necessary to produce hormones and build cells, too much can build up in your arteries and cause problems. LDL, low density, often called bad cholesterol. LDL can stick to artery walls and form plaque, narrowing the blood flow. This is why lowering LDL is a top priority for preventing heart disease. HDL, high density lipoprotein, the good cholesterol. HDL acts like a cleanup crew, collecting excess cholesterol and transporting it back to the liver. The higher your HDL, the more protection your heart has. Triglycerides, a type of fat your body stores for energy. High levels are often caused by overeating carbs, sugar, or alcohol, and are linked to increased heart risk. VLDL, very low density lipoprotein, transports triglycerides in the blood. While rarely listed separately, it's indirectly assessed through triglyceride levels. 9 HDL cholesterol. This includes all types of bad cholesterol, LDL, VLDL, and others. It gives a more complete picture of cardiovascular risk than LDL alone. In short, the lipid profile is a snapshot of the fats in your blood, a powerful early warning system for artery disease, high blood pressure, and strokes. It's a simple test, but if you understand it well and take action early, it could change your life. Point 2. Cholesterol risk zones. Understand the colors. Stay in control after taking your lipid profile test. You'll receive a report filled with numbers. But what do those numbers really mean? Are you in the safe zone or entering dangerous territory? A simple way to understand them is by grouping the results into color-coded zones like a traffic light: green safe, orange caution, and red high risk. Point 1. Total cholesterol, green, less than 200 mg DL. This is ideal, showing your total cholesterol is under control. Orange, between 200 to 239 mg DL, a warning sign. Time to improve your diet and lifestyle. Red, 240 mg DL or higher, high risk of atherosclerosis, heart attack or stroke. 2 LDL, bad cholesterol, green, less than 100 mg DL, optimal range. Orange, between 100 to 159 mg DL, acceptable if you're otherwise healthy, but should be monitored. Red, 160 mg DL or higher, high risk, needs immediate intervention. 3 HDL, good cholesterol, men should be above 40 mg DL, women should be above 50 mg DL. The higher your HDL, the better your protection against heart disease. 4 Triglycerides, green less than 150 mg DL, healthy. Orange between 150 to 500 mg DL, increasing risk, especially with high carb, sugar, alcohol intake. Red over 500 mg DL, very high, may lead to pancreatitis and heart complications. 5 non-HDL, cholesterol, calculated by adding 30 to your LDL, follow the same zone categories as LDL. This number gives a more complete picture of all the bad cholesterol types in your blood. 3. Important cholesterol ratios, a more complete view of heart health when reading your lipid test results. Most people focus on individual numbers like LDL or HDL, but cardiologists go beyond that. They also look at ratios because these offer a more balanced picture of your overall cholesterol health. 1. Total cholesterol HDL ratio. This is one of the most widely used markers for heart risk. Good less than 3.5 indicates enough HDL to balance your total cholesterol. Moderate between 3.5 to 5 requires monitoring and may need lifestyle changes. High risk above 5 suggests low HDL relative to your total cholesterol, increasing artery plaque risk. 2. LDL-HDL ratio. This shows how well your good cholesterol is keeping the bad cholesterol in check. Good, below 2.5 HDL is doing a great job. Moderate between 2.5 to 3.5 can be improved with diet and exercise. High risk over 3.5 LDL is too dominant, raising your risk of artery blockage. These ratios provide a more complete view of your heart risk than any single number alone. For example, even if your LDL is slightly high, a strong HDL level might balance it out. Conversely, if your HDL low, even with a normal LDL, your risk may still be significant. So next time you receive your lipid profile, don't just ask, "What are my numbers?" Ask, "How do these numbers relate to each other?" That's how you take smart, sustainable steps toward long-term heart health. Or, beyond the numbers, what else affects heart risk? When reviewing a lipid profile, many people focus entirely on the numbers LDL, HDL, triglycerides, but these numbers are only part of the cardiovascular picture. To truly understand your heart risk, you need to consider several other key factors, some of which can have even more influence than your cholesterol levels. 1. Age and gender. The older you are, the higher your heart risk, partly because LDL tends to rise with age. For women, estrogen offers natural heart protection before menopause, but after menopause, estrogen levels drop and heart risks rise. That's why women over 50 should be especially diligent about checking their lipid levels. 2. Genetics. A family history of heart disease, stroke, or inherited lipid disorders can raise your risk even if your lifestyle seems healthy. Some people carry genetic mutations that cause persistently high LDL regardless of diet. These cases require personalized care beyond lifestyle changes alone. 3. Lifestyle habits. Smoking, eating saturated fats, consuming fast food, and being sedentary damage artery walls, making it easier for bad cholesterol to build up and good cholesterol HDL to drop. On the flip side, regular exercise, eating more vegetables, sleeping well, and managing stress can improve your numbers and your long-term health. For underlying conditions, chronic illnesses like diabetes, high blood pressure, obesity, and inflammatory conditions such as arthritis or lupus also raise heart risks. These conditions damage the inner lining of arteries, making them more vulnerable to plaque buildup. The bottom line. Your lipid profile is important, but it's not the full story. The comprehensive heart risk assessment must include lifestyle, age, family, history, and any medical conditions. The best strategy Work closely with your doctor to build a personalized prevention and care plan, one that fits your body, your needs, and your life. 5. A comprehensive tool, the ASCVD risk score. When people see their cholesterol results, their first question is often, are my numbers too high, or do I need medication? But modern medicine doesn't rely on a single cholesterol number to decide treatment. Instead, it looks at your overall heart risk. One of the most trusted tools available today is the ASCVD risk score, which estimates your 10-year risk for cardiovascular events. ASCVD stands for atherosclerotic cardiovascular disease, which includes heart attacks and strokes caused by plaque buildup in the arteries. This score is based on large-scale population data and is recommended by the American Heart Association for clinical use. The ASCVD risk score calculates your risk based on 6 key factors. Age. Risk increases with age. Gender. Men tend to have higher risk at the same age. Blood pressure. Includes both your systolic reading and whether you're on treatment. Smoking status. Smoking sharply increases heart risk. Diabetes. Having diabetes significantly raises your risk. Cholesterol levels. Total cholesterol, LDL and HDL all factor in your result as a percentage. Your personal 10-year risk of having a heart attack or stroke. For example, a score of 12% means 12 out of 100 people like you will have a major cardiovascular event within the next decade. Why is this score so useful? It helps doctors decide whether you need statin medications to lower LDL. It prevents overtreatment in people with high cholesterol but low overall risk. It catches hidden risk in people who seem healthy but have family history or hidden conditions. In short, the ASCVD risk score offers a more accurate, personalized way to assess your heart risk, helping guide treatment that fits your body and lifestyle. This is how modern medicine designs smarter, not harsher, solutions for better health. 6. The key question, which matters more, LDL or HDL? One of the most common concerns patients have when reviewing their blood test results is, should I pay more attention to my LDL or HDL? The short answer is, both are important, but if you must prioritize one, LDL, the bad cholesterol, is the primary target for control. Why is LDL the most critical marker? LDL, low-density lipoprotein, is the type of cholesterol that can enter artery walls and contribute to plaque buildup, the leading cause of blocked arteries, heart attacks, and strokes. Large-scale studies around the world have shown that lowering LDL by just 40 mg DL can reduce cardiovascular risk by 20 to 25%. This is why current medical guidelines always prioritize lowering LDL first, HDL, the good cholesterol, but harder to change HDL. High-density lipoprotein works like a cleanup crew in your bloodstream. It collects excess cholesterol and transports it back to the liver for elimination. The higher your HDL, the better your arteries are protected. But unfortunately, raising HDL is not easy. There are no specific or effective medications proven to significantly raise HDL. Low HDL is often tied to deeper metabolic issues like insulin resistance or inherited lipid disorders. Healthy habits such as regular exercise, a clean diet, and quitting smoking may help raise HDL slightly, but usually not by much. So what's the smart strategy? Focus on tightly controlling LDL, especially if you have high risk factors like diabetes, hypertension, or a history of heart disease. Maintain HDL at acceptable levels above 40 mg DL for men and above 50 mg DL for women. If your HDL is low, work on improving your lifestyle. If both LDL is high and HDL is low, reducing LDL must be your top priority because LDL is the direct contributor to dangerous plaque buildup. In summary, In the cholesterol equation, LDL is the troublemaker that needs to be strictly managed, while HDL is the ally that's helpful but harder to influence. So start by taking charge of your LDL, and that will be the first step toward protecting your heart. 7. Final advice: don't just look at the numbers, see the whole picture when holding your lipid profile results. Many people focus on just one number, usually LDL or total cholesterol, and jump to conclusions. But in reality, heart health can't be judged by a single figure. The right scientific approach is to look at the whole picture, multiple factors working together. Cholesterol levels can vary based on age, gender, genetics, lifestyle, and underlying medical conditions. For example, someone with slightly high LDL but also high HDL, stable blood sugar, no smoking history, and a physically active lifestyle may have a much lower heart risk than someone with normal LDL but also diabetes and a sedentary lifestyle. That's why it's essential to understand not just the numbers, but the relationship between them, so you can make smart, personalized decisions. No two people are exactly alike, which is why you should work closely with your doctor to create a tailored care plan that fits your biology, health history, and way of life. Sometimes, simply improving your diet, exercising more, getting better sleep, and reducing stress can significantly improve your cholesterol levels without needing medication. But if your results fall into the danger zone, or you belong to a high-risk group such as having a history of heart disease, diabetes, or high blood pressure, don't hesitate to take medication as prescribed. The right treatment at the right time can prevent life-threatening complications like heart attacks or strokes. And most importantly, always remember this: prevention is better than cure. Getting regular lipid profile tests, understanding your numbers, and proactively changing your lifestyle are small, simple steps, but they can go a long way in protecting your heart and extending your life. If you're feeling overwhelmed by the numbers on your test report, don't worry. Start by learning, asking questions, and taking small actions, one step at a time. Your heart deserves daily care and attention. Final words: understanding your cholesterol numbers doesn't just help you monitor your health, it empowers you to make better daily choices. From what you eat in the morning to how you move your body. Remember, not every number is scary if you understand it and manage it the right way. And most of all, you're not alone on this journey. If this video has been helpful to you, please consider subscribing to the channel so I can continue to support you in the long run. Don't forget to like and share this video with your loved ones, because sometimes a single piece of timely information can make a world of difference in someone's life. Thank you for watching, and I'll see you in the next video.